Welcome back to another episode of Black Facts. Today, I want to talk to you about a serious subject matter. As you all know, the Black community was disproportionately affected by COVID 19. And I don't know about y'all, but I'm just tired. I'm tired of hearing about how we're disproportionately affected by this, that, and the other, and how we have the worst health outcomes of any ethnic group. So, this time, let's talk about it. Let's get ahead of it. Let's make sure that we know the facts so we can stay safe. You're probably wondering, what am I talking about? Well, I'm talking about monkeypox. So let's get into it. Let's talk about monkeypox. So I'm sure you're out there wondering, what is monkeypox? And is it fatal? Monkeypox is a virus, just like COVID 19. And it was actually reported in the first human in 1970. And now is being declared as a public health emergency in the United States. Now, before, people didn't really talk about it, it wasn't that big of a deal, but now it's declared a public health emergency. So we want to get on top of this. We don't want to be behind, the narrative and Johnny Jane come lately. We want to make sure that we know how we can stay safe and not get monkeypox. You're probably wondering too, you asked if it's fatal. No, it's not fatal. Most symptoms are non-life threatening, but currently is no cure for monkeypox. But there are medications to manage the symptoms. So what are the signs and symptoms of monkeypox? Symptoms include a rash on the face, chest, feet, and sometimes in the genital areas. And they look like blisters, and they're oftentimes very itchy. Other symptoms include flu-like symptoms, fevers, chills, swollen lymph nodes, headaches, and respiratory symptoms. And so it can mimic, in the beginning, it can definitely mimic COVID. You can think, oh, I'm feeling feverish, I'm feeling tired, I wonder if I contracted COVID. But you'll know that it's not COVID if you start exhibiting a rash. And then one thing that we need to be very, very mindful is the symptoms can last 2 to 4 weeks. So that means you are contagious for that time until the rash totally heals and scabs over and falls off. You are still contagious. So this is the big thing that we need to make sure to keep ourselves safe with this particular virus, because you can be exposed early on and not get a rash till 1 to 2 weeks later, and then you still have another couple of weeks to go through the whole process of the rash, the blisters happening, and you could be exposing the virus to other people. So we really, really, really want to be careful. If you exhibit any symptoms, flu-like symptoms, see a fever, chills, if you see a rash, make sure you go to your provider right away. Make sure you run, not walk. Go to your provider. Make sure you get the medications that you need so that you're not, you can heal faster and you're not exposing others and, spreading the virus. Folks are also wondering, is monkeypox the same thing as chickenpox or smallpox, since you also get a rash or a blister when you get those? And the answer is no, they are all different viruses. But what is similar about them is that they have similar symptoms. So just like COVID 19, the flu like symptoms, that you have, and like chickenpox and smallpox, how monkeypox kind of mimics those as well, or is similar to those, is you have a blister or a rash that presents itself. So we just want to make sure that, we're able to identify the differences between the types of symptoms immediately. If you start feeling feverish, chills, like you're coming down with the flu, go in, get tested for COVID first, make sure you don't have COVID. And then if you don't have COVID, talk to your doctor about, whether or not you could potentially have monkeypox, because the rash may not necessarily present itself right away. It may take some time, even a week or two, before it actually presents itself. So make sure, now you have the information. If you're feeling any of these symptoms, make sure to check for COVID and monkeypox. So you're probably wondering, well, how do we protect ourselves? And should we refrain from shaking hands and hugging people? Yes. You need to make sure that you're doing the same precautions. I know I keep saying this, but with COVID, you need to wash your hands frequently. And if you have that trusty hand sanitizer, don't put it away, folks. I know they keep telling you that COVID is gone, but COVID is still here and ever present. So, and now we have to deal with monkeypox. So make sure that you're using the proper safety precautions. Wash your hands, make sure you have clean hands. Make sure that, if you're not around some water, that you keep your trusty hand sanitizer readily available so that you can make sure to clean your hands if you're touching surfaces, if you're touching linens and different things, because you can get it from not just contacting human contact, but you can get it from touching other items. The virus is live and it lives on bedding and different things. So if somebody has the active virus, if they touch something, you can get it from the fluids and stuff that that the blisters have exposed onto linen, clothing. So we really, really, really want to make sure that we're staying safe and that we're being careful. And also, the Center for Disease Control recommends that you limit your sex partners because, again, it can be transmitted through fluids, with the blistering, open sores, getting on you, the fluids from, bodily fluids. So just make sure that you're being safe and that you're using the proper safety precautions to keep yourself safe and prevent yourself from getting the virus. Is there a vaccine for monkeypox? The good news is yes, there's a preferred vaccine to protect against monkeypox. It's called Jynneos, and it's a 2-dose vaccine just like COVID-19. So you know how we had to get our first dosage of the vaccine for COVID, and then you had to wait 28 days later to get the second dose. It's exactly the same thing. The only thing that's different from this, not everybody is going to be able to get the monkeypox vaccination because it is currently unavailable to the society as a whole, to the general population. There's a limited supply. So again, you would have to go to your provider and ask them if you are considered an individual that is high risk and that would be eligible to be able to get, the monkeypox vaccine. So if you have some type of already diagnosed chronic illness, something that is compromising your immune system, I would advise that, for you to go to your physician, your provider, talk to them and ask them if you would be eligible to get the monkeypox because it could present itself differently if you already have a compromised immune system. So make sure you talk to your provider about it and make sure that, you go and say, I know that there's a vaccine available. I just want to make sure or find out whether or not I'm, eligible to be able to receive that vaccination. And then you're wondering, I'm sure, because I was wondering, is there anything else that we should know about monkeypox? And my answer to you is yes. You have control over your health and well being. I'm going to say that again. We all have control over our health and well being. Now that you know the facts, make choices. Make good choices, the choices that will help keep you safe and healthy. I hope this episode has been informative. I hope you've learned something. I hope you feel empowered to be able to ask your provider questions. I hope you feel empowered to be able to go out there and be safe and protected when you go out to your job, to school. Let's make sure that we're doing our research. Let's just don't let this, we went through COVID, we're still in COVID. Let's not miss the lesson that we all should have learned living and, surviving through COVID. So let's make sure that any new virus that presents itself, if we have to go through another pandemic, that we stay informed, that we know the facts so that we're able to keep ourselves safe and healthy and also do the same for our families. So thank you for joining me on this episode of Black Facts. I hope that you've, again, learned some facts and make sure to like, share, and comment down below. All the information is down below. And I hope you'll join me on another episode of Black Facts. Take care, everyone.